Hey, good evening, Shaun. Do you hear me?
Hello.
Hi, Shaun. How are you?
Good. How are you?
Very good, thank you. Sorry for the technical difficulties. We keep running into these.
Yeah. Sorry.
No, 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 not your fault. It's we're learning the Twitter Space system ourselves. Uh,
Uh,
do do you hear me right now, or am I staticky?
no, you're good.
Wonderful. Okay, so I think we can get started. We do have some live listeners right now, and this talk is being recorded, so we'll be able to share it on online. But
Okay.
good evening, everyone, and thank you very much for joining us for another Survivor Aorta Chat interview as part of Aortic Disease Awareness Month. My name is Adam Ahmed. I'm a fourth year student at CUNY, and today we're very excited to have Ms. Shaun Nicole on the line with us. Shaun survived an acute aortic rupture in September 2015 when she was 8 months pregnant at the time. She's a native of Baton Rouge, Louisiana. Currently, her hobbies include traveling around the world and volunteering for the Think Aorta work group. She's the Aortic Hope social media ambassador, as well as a dear friend of all of us. Shaun, how are you today? Thank you so much for coming live.
I'm great. I'm excited to do this. Right.
Great. So maybe we could get started by just hearing a little bit about yourself, the story of your dissection, and sort of what led you here to this point.
Well, my name is Shaun, and I'm from Baton Rouge, Louisiana. Um, Mother of four, and I dissected at the age of 35, and when I was 8 months pregnant. Although pregnancy can cause aortic dissection, mine was actually caused by an autoimmune disease called ankylosing spondylitis. This disease caused my aorta to become enlarged to the point of dissection, and then it ultimately ruptured, going into surgery. I had emergency open heart surgery and a C-section simultaneously, hoping, to give us both a chance. However, my daughter Lily, she lost blood supply, and they couldn't save her. Um, I had to get involved with this after that. Yeah,
I'm very sorry to hear that you had to go through that.
thank
Well,
you.
could, could you tell us a little bit about your experience after your dissection? What sort of how you recovered and what that was like?
Well, like I said, I had to get involved afterwards. I had to talk with other survivors. I had to talk with doctors. I had to talk with anyone I could that knew what was going on. I read everything. I studied on everything I could get my hands on because for me, like it was a peace of mind for me. Um, and it continues that way now. I have to be involved to be able to cope with everything that happened mentally for my mental health.
Of course. I mean, and you managed to really turn a traumatic experience into a way for you to serve others. I mean, how did you get involved with the Aortic Hope first of all, and how did you find the strength to kind of use your experience to maybe guide others through similar ones?
Well, I mean, like I said, it was very difficult mentally, especially because of my daughter losing her life. So, in coping with that, I've been able to find it helps bring awareness for people. Um, People need to understand the symptoms, the signs, everything about aortic disease. I want to, share that with people so they don't get in another situation like I was in.
Absolutely. And that's definitely something we're all trying to do here this month of September in Aortic Disease Awareness Month. A lot of the audience on today are medical students and aspiring cardiothoracic surgeons. What are your hopes for the next generation of healthcare providers? Well, what are things we should know to do better?
I think the number one most important thing is listen to your patients. In my personal experience, when I went into the ER, the doctors and nurses were not taking me seriously. And it took me going into cardiac arrest 6 hours after I went into the hospital for them to say, oh, maybe something's wrong. Maybe she's not lying. Maybe she's not a drug seeker. That sort of thing. Listen to your patients. I think that's the biggest one. And, if they would have done that, if they wouldn't have wasted all those hours, maybe it would have been a better outcome for me, for my child, you know, and also knowing the signs, the symptoms of aortic dissection, be familiar with the diseases that can compromise your aorta. That's all really important. It thinking aorta just needs to be on the brain, of doctors, people who work in hospitals, nurses. They need to think about it. So,
Absolutely. So you said when you went into the hospital, you felt like your concerns weren't being listened to. Did they misdiagnose you with something? What were some of the things that they said that you might have, or what were some of the tests that they put you through instead of getting you into a CAT scan?
they um they really just put me in a room. The pain was so great that I was literally yelling and begging someone to help me, begging them something's wrong, I'm telling you something's wrong. And they just kept me there for 6 hours. And they didn't do anything. They didn't listen to me, and it did not turn out good at all.
Absolutely.
It wasn't that I was misdiagnosed, it was just not done timely enough.
I don't even have the words. I'm sorry that you had to go through that, as a patient, as a mother. Um, After you said that your aortic dissection was caused by ankylosing spondylitis or associated with it.
Yes, sir.
Was this something that were you aware that you had a diagnosis of ankylosing spondylitis before your dissection, or is that something that came up after?
No, I did know. I found out I had AS. It's easier to say AS. When I was 12, but never one time did a rheumatologist or a doctor say that this could be associated with this. Never was I checked any cardiologist appointments, nothing. I had no idea this could happen with it, and it did.
So you weren't told that your aortic your condition could affect your aorta, and you weren't
Yeah,
made right.
yeah, I had no idea.
And after that, knowing what you know now and knowing what we've the associations and some of the risk factors for aortic disease, um, what as students we've been trying to kind of spread that message along and try to get patients and you know first responders to kind of think, could this presentation be something that's aortic disease? Is this something that we need to ask more questions about? What do you think are questions that we could ask, or which were questions that you were asked, in the ED that might have been able to, get us to the right position? You said that you were in severe pain and
Yeah,
they were not taking account of that. What are some of the questions you wish were asked?
they they should have asked me, where is the pain? That was asked no questions. I was just told point blank, you're not going to get anything for pain, and you need to sit here and wait your turn. So nobody worked me up or anything. There was nothing. I just sat there, just sat there. So I mean, just the doctors talk to your patient. I knew this was not right, but they weren't talking to me. They wouldn't do anything at all. It was a bad experience, and I just don't want anyone else to have to go through that.
So, absolutely, Shaun. I mean, again, I think that's the importance of survivors like you coming out and speaking your story and really getting us to be aware that these things happen. They happen every day, and
Yeah.
really try to do our small part to change it, to change the way we think about how we approach your disease and really how we approach any patient coming in pain.
Yeah.
Um, so what for patients that might be listening to this, could you recommend any resources or things that you found very helpful as you were recovering? I know you got involved with the Aortic Hope Group. Were there any research? You said you did a lot of research on your own after. What are some recommendations you might have for patients listening?
I would recommend, doing the same thing, reading everything you can on it, finding support groups. That was awesome for me to go and to be able to talk with other survivors, like in Aortic Hope. I could ask them questions. They could give me tips and tricks, and because it's a whole new life you got to live now. So that really was the best thing, I think. Aortic Hope, connecting with other people to bond with. It does wonders for you.
Absolutely, and I think really your willingness to participate in other survivors, participating in groups like this, and giving that outlet for people who are new is really what has helped grow the community and made it so effective. Um, I wanted to ask you a little bit. You mentioned to me that you were traveling later this month for the annual Aortic Disease Awareness Day I believe, in Edinburgh, Scotland. Could you tell us a little bit about the event and what you're most excited for?
Yes. Well, I'm most excited to hear the speakers. They have great speakers. I'm going to learn a lot. I'm going to fellowship with other survivors and explore Scotland. I think it's going to be a great time.
Absolutely, and I'm very excited. I wish I could have made it this year. I know we were in the Eastern together last year and got to run that table.
Yeah.
So now you're going to Europe, so that's very exciting.
It is.
And we do have some new listeners, on the line, and people who are really just trying to familiarize themselves with the term "think aorta," and it's managed to really grow into this global, phrase, and the poster has been translated in several languages. It's been distributed over several continents. But just someone completely new to this, can you tell us what does thinking aorta mean to you?
Well, it means the world to me. Um, my personal mission is to get physicians out there thinking aorta in the ERs and the doctor's offices, the nurses. I don't want people to lose their life because it was missed or misdiagnosed. And I really want them to start thinking, aorta. Let's put it in everyone's mind. I think because it doesn't happen as often, it's not something that they think about too often, maybe.
Absolutely,
But
absolutely.
yeah.
Thank you so much for saying that, and for sharing your experiences. You've given a lot of, sharing your story and giving your insights. You've given something for all of us to think about as students on the line today. Do you have any closing remarks for our listeners?
Just educate yourselves and thank you for having me. I really appreciate it.
Thank you for coming on and sharing your story. And I know these aren't easy conversations to have, and especially on the line with everyone. But it's important, like you said, to get us thinking and to make sure things like this do not happen again.
Yeah.
Get us thinking and asking the right questions. So really, your perspective is incredibly important for us, to learn and really aspire to do better. Shaun, thank you so much for being on today on behalf of the
Oh,
TSMA
thank you.
community. I hope you have a wonderful time in Scotland later this month. You'll have to let us know how it goes. And
Okay.
thank you so much.
Oh, thank you.
All right.
Bye.
Have a great day, everyone. Thank you.